Hello, this is Marshall Riddle from MCUL, welcoming Bill DeMarco, President and CEO of Pendulum Healthcare Development Corporation. Thank you for joining us, Bill.
Good morning, and thank you for the invitation. We always like working with our friends at MCOL. I'd like to just start an overview of some of the slides that I've placed on the web for people to take a look at here by saying that we are in a transition, moving away from what the physician practice model was to what the physician practice model may be in the future. And of course that's aligning some new models of delivery and financing, which a lot of us have been talking about for quite a long time. One of the mistakes we see is that a lot of the organizations focus almost exclusively on the structure of their enterprise, when in fact they really should be looking at their environment. What is it that is going on in their marketplace, and is this the right time to build this kind of a high-performance panel or high-performance market? And of course the marketplace for hospitals, physicians, and other ancillary care providers is changing. Employers, in fact, as I speak to you today, we're preparing an accountable care organization network for a very large self-funded employer, and we have another self-funded employer that's coming in as well with the same request. So we're seeing a whole shift in opportunities here, both in the private as well as obviously in the public marketplace for Medicare and Medicaid. What I've done here is really look at three basic models. First being a staff model or a closed panel type of network that physicians could build, and talk a little bit about why these particular physicians selected that type of an approach versus some other type of an approach. Then I talk a little bit about mixed model, where we have physicians, some are independent and some are basically part of the core group, and we're seeing a lot of multi-specialty group practices starting out that way and expanding their medical staff and or referral base by doing things that are a little bit unusual. Then we talk a little bit about the open panel. Of course, everybody's pretty much familiar with an independent practice association, but what we're seeing here is that the big difference is that we're going to focus on medical management, not on just the traditional, this is a doctor's club, and we're going to try and get as close to the dollar amount we want from employers and or from the government here. So there's a lot of competition for these particular groups, and the comparison between these three models that I'm suggesting, both in terms of product as well as the biggest disasters, are also discussed in this particular overview. Then we talk a little bit about medical management, because I think that's really the sticking point. People are worried about what happened back in the 90s, and now with an opportunity to rebuild this, are we going to make the same mistakes? And we certainly hope that's not going to happen. So what we're looking at is building the model that will best meet the payer's needs in that particular market, with the first goal, again, looking at a product, not necessarily jumping onto just organizational structure, but really looking at the product. And the second goal is then to organize that provider network around what product you're going to put together. The third goal is to develop that price point that you think will be logical, and of course there's some federal rules and regs on that. And then the fourth goal is to make your standards, make your checks and balances in place so that you can actually hold yourself as a high-performance panel, and you can demonstrate that with the kinds of performance reports you're looking at. From there, we also discuss a little bit about joining the hospital and the physicians together. Alignment's always been a quest for most of the hospitals and physicians, but I think with technology and better infrastructure, we have a better chance of doing that now than we've ever had before. And then we make the leap into accountable care organizations, such things as setting clinical benchmarks, setting spending benchmarks, and then give you a couple of examples of episode treatment groupings, ETGs. The government's still working on episodes of care, whether it will be episode treatment groupings per se or some variation thereof, but getting people to start to think in terms of global payment, or in terms of really globally defining care units, if you will. The future view of what the federal government firm is looking at is much more focused on value-based purchasing than it is on just looking at comparing ICD-9 codes and comparing DRGs. So we put a couple performance reports as examples to say, well, this is the kind of data you'll need to clarify your position in the marketplace. We think physicians have a great opportunity to lead. We've thought this early on. We are very much assured by many of the large multi-specialty group practices as well as many of the independent physicians who are now building smaller 8 and 10 member groups that in fact this is the way to go to share overhead and to operate in a way that allows better continuity of care through the hire of additional staff, nurse practitioners, case managers, others that will help people through this entire delivery system process and help them navigate the complexities of it. But more importantly, it will focus the physician's ability to really work more into the challenge that they got into medicine for to begin with, and that was something that a lot of physicians are saying, this routine stuff is just killing me. I really want to do something that's a little bit more sophisticated, and there is a way to obviously do that. So we're excited about the opportunity for performance networks. We are seeing definitely employers moving quicker than the federal government is on all of this, and there is more information out there today on technology and the use of measurements and benchmarks than there's ever been before. So those tools are available, and we encourage physicians to think that the environment is going to shift, and we hope that they, when they have to choose sides, that they choose their own.
Thanks again, Bill. This presentation is complete.